Okay, thank you very much to everybody for arriving. I'm just going to make a couple of quick technical announcements before we start the event. So bear with me. So first of all, good afternoon and good morning to people who may be in other time zones online. This is a hybrid event. So just very quickly, technical announcement. Just for those of you joining here, just because we're aware that a number of people have started to test positive at events here this week, in response, we as NCD Alliance have taken the choice to start wearing face masks. I have to keep it above my nose. And we've made them available to you in the room if you choose to wear them. It's, you know, we all know the choices we have to make. On technical notes in terms of the hybrid event, for those of you joining us online, for assistance, please use the chat function to message anyone with the title Technical Facilitator in their name. And in order to ensure the best quality of speaker interventions, the mic function is switched off, disabled for our online participants, but we would really like to get your contributions and perspectives, so please do share them using the chat function. I'm not used to this, it's been a while. Contribute with a perspective, idea or questions. Just really, please do use that chat function and chat online. And you can find that feature at the bottom of your Zoom window. And lastly, this section is being recorded for documentation purposes, so be aware. And we're also streaming live on Facebook to reach a larger audience. So we're really hoping as well as the people here in the room, we have people online. So I'm going to hand over to José Luis Castro, who's going to welcome you here today. So thank you, José.
I will remove my mask. I think it might be easier for speaking, but good afternoon and good morning to our distinguished guests, both here and in person, and those who are joining us online. It's really good to be able to have this meeting in person. Again, thank you. Can you hear now? I'm José Luis Castro. I'm the president and CEO of Vital Strategies. And on behalf of our co-host today, the NCD Alliance, NCD Child, the World Obesity Federation, and the Ministry of Health and Wellness of Barbados, it's my pleasure to welcome you. This event marks the first time that these co-hosting organizations have convened stakeholders in person, as well as virtually since the COVID-19 pandemic. As we continue to grapple with COVID-19, NCD prevention is particularly timely. We know, for example, that obesity is linked to more severe COVID, just as other diet-related NCDs. If we are to beat COVID, or whatever comes down the road next, we need to eliminate the unhealthiest items from our diets by rethinking our food systems. We need to act now. And it is my great pleasure to introduce our first set of speakers today. WHO Assistant Director General, Dr. Naoko Yamamoto, and Her Royal Highness, Princess Dina Mired of Jordan. Dr. Yamamoto leads the WHO's Division of Universal Health Coverage, Healthier Populations, and brings nearly 30 years of experience working on health in Japan. She served as Senior Assistant Minister for Global Health in Japan's Ministry of Health, Labor, and Welfare. And in this capacity, she was heavily involved in Japan's global health leadership, including hosting and organizing the International Conference on Universal Health Coverage in 2015, and supporting the G7 process in 2016, which highlighted the importance of promoting universal health coverage. Our next speaker, Princess Dina Mired of Jordan, is a passionate, long-time global champion of cancer control, non-communicable disease prevention, and women's health. In 2020, Vital Strategies was honored to welcome her as our special envoy for non-communicable diseases. And in this role, Princess Dina is a voice for action, especially when it comes to protecting adults and children from the industries producing unhealthy foods, alcohol, and tobacco that drive NCDs. She served as Director General of the King Hussein Cancer Foundation in Jordan for 15 years. And it is a testament to her outstanding leadership. She was elected president of the Union for International Cancer Control in 2018. Princess Dina has received many awards for her work, including the Medal of Honor from the International Agency for Research on Cancer. Dr. Yamamoto, over to you, please.
Your Excellency, dear colleagues and friends, dear organizers, the host and the participants online in person. Thank you very much for your kind invitation first. So good health and sustainable development are not possible without good nutrition and nutritious food system. In fact, achieving WHA universal health coverage and healthy population will not be possible without strong integration nutrition action into national health plans and reinforced investment in the nutrition and food system. At the WHO, Director General Tedros outlines 5 priorities moving towards the next 5 years. And the first priority is support countries to make a change toward health promotion, well-being, and decrease disease prevention by addressing the root causes of ill health. Actually, the DG has just now re-elected. And going to the next 5 years, he just finished his speech remarks, and still everybody congratulating, taking a photo and so on. So many people right now coming because they need to come by bicycle, like a Francesco Branca. My taxi is lost away, and other people running so fun. And now many people can join in person, but in a virtual way. So thank you very much again for hosting this meeting. So let's go back to the DG's first priority. Again, his first priority is support country to make change toward the health promotion, well-being, and disease prevention by addressing root causes of health. And obviously, reducing unhealthy diet, preventing NCD, non-communicable disease, are at the core of this priority. This is the most important issues for us as WHO, to work at the global level, regional level, but most importantly, at the country level and the community level. So in fact, 85% and 80% of the deaths related to NCD occur in low and middle income countries. But at the rich countries or rich nations, the burden is higher among the poorer or more vulnerable population. And as we may have seen, the new WHO investment case launched yesterday during WHA, intervention-related NCD prevention have a large return investment. For every $1 US invested in addressing NCD risk factors, the return can be high at $7 US. That is why we need to continue to advocate for the implementation of WHO's best advice and related intervention. So we are going to continue to work for it. For example, last year we had 2 major global events to call attention importance of nutrition and food system. One is UN Food System Summit, which brought global attention to the way in which our food system shape the health of people and planet. So we talk about animal health and human health and planet health. Another meeting is Nutrition for Growth Summit, which was a significant driver to tackle malnutrition in all forms and achieve the WHO global nutrition target by 2025, as well as SDG target by 2030. The Nutrition for Growth Compact include multiple commitments by stakeholders, including WHO, all member states, and also low middle income, high income countries, and also other private sector and civil society. So we will continue to work together. I think I don't necessarily to talk about the COVID-19 negative impact, the huge impact of COVID-19, but we are talking about post-COVID-19, how we can recreate our society more healthier, resilient, fairer, and healthier. So, and greener as well. So today's discussion should be the really relevant and timely issues, and they're looking forward to discuss with all of you So now you are waiting, our wonderful speaker. So next is Princess Dia Mired. So she's a champion, really champion in this area. So I'm very happy to invite her. So welcome. Thank you.
Colleagues and friends, I'm glad you all made it, yeah, to this bit obscure location, but you all made it. Good afternoon, distinguished guests. It's my pleasure to join you here today to talk about NCD prevention and countering the insidious influence of unhealthy foods. There's a common denominator between increased NCDs and the 12 million preventable deaths per year from unhealthy diets. It's ultra-processed foods. This gives poor diet the dubious distinction of being the deadliest NCD risk factor. Think about that. Junk food now claims more lives than tobacco. In the decades since ultra-processed foods appeared on supermarket shelves, they have been aggressively promoted and marketed around the world, displacing traditional and healthier foods and diets. Cheap, easily accessible, and evidence shows at times addictive. These products, high in salt, fat, and sugar, have infiltrated our diets. In some countries, they account for 50% of the calorie intake. 50%. It's incredible. There is even some debate about whether ultra-processed foods can be called food at all. They do not resemble anything that you can prepare in the kitchen. Made from ingredients that use industrial processes, these harmful products are appealing as they are preserved, packaged beautifully, convenient, and ready to eat. But ultra-processed food products are exposing billions of people to a higher risk of diabetes, heart disease, stroke, and obesity. Obesity has nearly tripled since 1975. Today, 2 billion people live with overweight or obesity. 2 billion people. This pattern, the rising toll of NCDs fueled by ultra-processed foods, is like a runaway train. We need to slow it down immediately. The World Health Organization has designated what is known as best buys, prioritizing the most cost-effective and easy to implement interventions to prevent and control NCDs. Implementing these is one way to apply the brakes to the train. But the best buys on reducing unhealthy diets do not go far enough. The link between rising NCD rates and ultra-processed foods may be clear to all of us here today, but we need to sound the alarm to warn the public and policymakers. Best buy recommendations should expand to protect consumers from the insidious harms inflicted by these products. For instance, we have tools to reduce the consumption of unhealthy foods. We can tax sugary beverages and ultra-processed foods and requiring front of package warning labels for products high in sugar, salt, and fat. Since consumers are often purposefully misled by the food industry about the harmful effects of these products, we must promote better understanding of nutrition and conduct media campaigns that alert the public to the perils of ultra-processed foods. It is particularly vital that we protect the most innocent victims of aggressive and often unethical food and beverage industry marketing. The food industry preys on children, marketing their products across traditional and online channels to addict future generations to these harmful fake foods. Today, 42 million children under the age of 5 are obese or overweight. We push for marketing controls on tobacco and to limit children's access to that deadly product, but we also need to push the same, just as hard, against ultra-processed foods. We can start by recognizing the real drivers of this accelerating wreck, the multinational food and beverage companies that promote overconsumption of unhealthy food and sugary drinks for profit. Like the tobacco industry, multinational food and beverage companies have clout and resources. But we, as champions of public health, are not powerless against them. For starters, giving the food and beverage industry a seat at the policy table is like letting the fox guard the hens. Let's leave health policy to the experts, rather than those who are eager to promote their own commercial interests. It's incumbent about governments to implement strong policies that enforce the public's access to healthy and nutritious foods. This includes meaningful taxes on ultra-processed products to limit consumption and mandatory, easy-to-read front-of-package warning labels. Some countries have already taken steps to apply the brakes. Chile, Uruguay, Mexico have introduced simple warning labels on food packaging. More countries have introduced taxes on sugary drinks, a victory that was recently achieved in Barbados. Just last month, Barbados increased excise tax on sweetened beverages to 20%. This is a big deal, my friends. Thank you to all those countries who've been brave enough and responsible enough to want to protect your citizens. Thank you. These actions steer consumers towards a healthier path and reducing the risk of NCDs. As Vital Strategies food policy lead, Trish Cotter, recently wrote in a commentary in BMJ Global Health. It's high time that consumers had the opportunity to see the ultra-processed foods for what they are. Foods that are not real foods. They're not. Containing nutrients, but not real nutrition. Pervasively marketed by supranational companies, offering choices that are not real choices. It is time to digest this uncomfortable truth, my friends. Thank you very much.
Thank you, Princess Dina. And now I will turn this event over to your most capable moderator, Mrs. Johanna Ralston, the CEO of the World Obesity Federation. Johanna is a global leader in non-communicable disease advocacy with over 20 years experience and working on NCDs worldwide. Johanna oversees the implementation of the World Obesity Federation 5-year plan for 2020-25, including advocacy for global obesity targets, education and capacity building, and evidence and data. Before joining the World Obesity Federation in 2017, Johanna was the CEO of the World Heart Federation and vice chair of the NCD Alliance. From 1999 to 2011, Johanna was the vice president for global strategies at the American Cancer Society. Thank you, and the floor is yours, Johanna.
Hello, everybody. Thank you. It's a pleasure to be here. I am going to introduce our panelists and ask them as I introduce them to come up. And we will start with the Honorable Ian Gooding-Edghill, the Barbados Minister of Health and Wellness. He's going to be speaking to national and regional efforts to reduce the burden of diet-related NCDs in the Caribbean, and please welcome and have a seat, including the recent increase of sugar-sweetened beverage tax in Barbados. The minister has been in this role since 2022. Previously, he was Minister of Transport, so he's very well suited to comprehensive and integrated approach to NCDs and has a history in human resources and the business, which is really helpful and useful. Dr. Francesco Branca will also, I'll also ask you to take a seat, Director of Department of Nutrition and Food Safety at the World Health Organization. Dr. Branca is a longtime advocate and supporter of healthy foods and has been developing the obesity strategy guidelines as well as broader nutrition guidelines and WHO best buys. We also have Dr. Nandita Murukutla, who is here. Okay, you can see Nandita, who is a social scientist and the Vice President of Global Policy and Research at Vital Strategies in New York and India. She has a background as a social scientist, and her team has developed evidence for policy change in over 60 countries. We have Dr. Simon Barquera, who's Executive Director of the Nutrition and Health Research Center at the National Institute of Public Health in Mexico. Dr. Barquera has been involved in some of the successful work that we'll be hearing about in Mexico. He is also sits on various committees, National Academy of Medicine, and also happens to be on the World Obesity Federation Policy and Prevention Committee. And our young leader, Ms. Ana Larrañaga, who is the NCD Young Child Leader. She is studying commercial determinants of health at University of Sussex and has been working as a civil society advocate since 2014. So we're going to hear about mobilizing young people. I'm going to start with some questions, and I'll do it from here. I'd like to start with the minister telling us a bit about your experience and recent success in the sugar sweetened beverage tax, and particularly, so the CARICOM region and Barbados in particular have been real champions. If you're not aware of this, they've been the champions of the NCD agenda and have now been really advancing action on the unhealthy diets and NCD prevention. In line with WHO recommendations, Barbados recently incremented its tax on sugar sweetened beverages. What prompted the increase of the tax to 20%? Could you tell us a bit more about this, Minister? Thank you.
Thank you very much, Ms. Ralston. And first of all, let me apologize for my late arrival. I was attending to other matters at WHA, sorry. And as a result, I was running late, so my apologies. The sugar sweetened beverage taxation rate was, as alluded to earlier, was 10% in 2015. And in the last budget, our Prime Minister, the Honorable Mia Amor-Montley, when she introduced the budget to Parliament, agreed that it was necessary to advance it to another by another 10 points, and therefore the current rate is 20%. We had to do so because we recognized when we first did the 10% tax, there was a 4.3% reduction in consumption of sugar sweetened beverages. And this was, in our opinion, far from what was required to have a significant impact on the prevalence rate. And therefore, we undertook the initiative, and it would receive wide support. Of course, and you would appreciate that we would have had lobbyists against us. That never stopped us in any respect from advancing the cause. We are having significant rates as it relates to NCDs, and the cost, the general cost of NCDs and to manage NCDs, it's astronomical. And therefore, the Prime Minister led from in front, as she always does, and should we agree to move this to 10 by another 10 points? So therefore, we're at 20%. And we believe that it will have the required impact. We are going to continue to measure the impact. And therefore, with measurement, we are also in the process of undertaking a stakeholders meeting and further discussions with the stakeholders in order to find out from them what are some of the issues and concerns, but generally to motivate them and lead them in the right direction, that is to move to a reduction in sugar sweetened beverages. Thank you.
Wonderful, thank you. And I'd like to ask you now about front of pack labeling as well. So we've seen successful and impactful implementation of front of pack high-end warnings in countries like Chile and Mexico. We know that this is a process that's underway in CARICOM, being with Barbados being a champion of this. What are the main highlights and challenges of this? What are some of the issues you're seeing, and is a regional approach helping to improve the food environment?
Yeah, sure. Thank you. We will, for example, as you know, Barbados is part of CARICOM, which is a grouping of Caribbean countries. And front of packaging warning labels are developed by countries. And of course, Barbados is a net importer of packaged foods. And therefore, we receive foods with a wide variety of package labeling. And this complicates the process for us because with the adoption of either national or regional tariffs and or agreements, it therefore means that importers would have to affix the appropriate labels, warning labels that is, to import products. Now, this process is likely to lead to a lot of logistical issues, and therefore we are working in conjunction with CARICOM in order to facilitate the front of packaging warning. In fact, about approximately 3 weeks ago, I had the honor to chair a COSOD meeting within the CARICOM, and we had this point of discussion, and we're moving with some alacrity in order to address the issue. But we also know that because we are importer of goods, we obviously have challenges with front of packaging label coming from maybe Mexico and obviously other areas like China, where they may not be as keen to create specific labeling for countries like Barbados. But it continues to be a work in process, and we will continue to advocate to ensure we achieve the objective.
Wonderful. And I want to note that I happen to be a member of the fan club of your Prime Minister, who just was this week announced as one of Time Magazine's 100 most influential people in the world. She's extraordinary. And I think we'll actually come back to that and that kind of level of political support.
Sure.
But first, I want to speak to Dr. Branca, sorry, and hear a bit about, we're hearing a lot about WHO best buys. You've been very involved in these. We want to understand a bit, what is the process behind making the case for their cost effectiveness? How does that happen? What has changed? What happens when new evidence emerges? And tell us a bit about that sort of a next steps. Where are we in this?
Yeah, thanks, Johanna, and thanks to the NCD Alliance and other strategies to have convened us today here. The concept of best buys is really linked to the analysis of cost effectiveness of interventions. So first, we need to understand whether an intervention is actually producing the impact it's meant to produce. Do we have any real concrete documented evidence from monitoring studies on the ground? That's the first thing we need to do. And not always policies and interventions are well monitored. So that's the first challenge, effectiveness. Then we need to see whether the investment required to implement them is producing a return on that investment, which makes it basically worth doing. And so WHO has developed as an annex, used to call it annex, appendix 3 to the non-communicable disease action plan, a list of this cost-effective intervention. Then we went even further and we said, okay, but you can have a cost-effective intervention, but it can be very expensive. And so maybe there are some countries who may not be able to afford it. So let's really try to single out those which are really, cheap enough, less than $1, in relation to the daily averted, to the disability adjusted life years that you can save. And so we have two categories. We have the best buys and the good buys. But this is only a sub-selection. Then you have a lot of other important effective interventions. So this analysis of cost effectiveness, I must say, is a relatively new thing. And for some of the interventions on diet, we didn't have a lot of good information on effectiveness and cost effectiveness. So the first edition of the best buys only had a subset of intervention, which are the ones on salt. So reformulation, voluntary reformulation, front of the pack labeling, campaigns, but specifically on salt. They came out as actually highly cost effective. So they are part of the best buys. And then we said, oh, what about sugar taxation? Sugar taxation of sugar sweetened beverages. It's definitely cost effective, but it came a little bit above the threshold. So it's called a good buy at the moment. Then we had a lot of other important interventions, such as the trans fat bans, or regulation of marketing food to children, or even promotion, protection, and support of breastfeeding, public food procurement. They're all effective interventions, but we have not done the cost effectiveness analysis. So new world now, a bit more investment in this domain. And first of all, we've said, okay, but we probably can analyze systematically the science we have and produce WHO guidelines on effective interventions. And we are doing that. So we're about to publish a set of 4 guidelines, regulation on marketing food to children, which is not any longer voluntary, but is regulation, fiscal policies, and particularly taxation of sugar sweetened beverages, public food procurement, and interpretive labeling. Okay, so they will become basically WHO recommendation. I can anticipate that we're going to recommend countries to adopt these policies. In addition, we've updated the cost-effective analysis, and we've also modified slightly the combination. So it's not finished, but we're confident that we'll end up with the first set of new best buys, which are the voluntary reformulation, including salt, sugar, and industrial trans fat, number 1. Number 2, front of the pack labeling, addressing sodium saturated fat, trans fat, energy, and dietary intake. Then public food procurement, which will address sodium saturated fat, sugar sweetened beverages, and fruit and vegetable. The marketing one will probably come in a later iteration because we have not finished the cost effectiveness part. So this is what is in the pipeline. What is also interesting to say is that this will be accompanied by a series of implementation tools. So not only some packages that will make easier the implementation of the policies, such as the replace package for trans fat or the shake package for sodium, but also new tools such as the sodium benchmarks, which will help countries to set up country targets for each of the categories of food. And then a series of materials like policy briefs to explain really clearly the implementation.
Great, thank you. I think implementation is key, and I think we actually already heard one interesting example of implementation challenges in the Barbados piece, where you have multiple countries importing food from multiple countries and having different regulations in a way that are reflected in front of pack labeling. So let's hear a little bit more about some of the other challenges with implementation from Nandita. You've been very involved in implementation issues in various countries that Vital Strategies has been working, and we know that health harming industries continue to pose major opposition to WHO best buys. That's a big challenge, and to implementation of those in different countries. We have examples such as opposition to the implementation of a sugar tax in Nigeria, and to the challenges around front of pack labeling in Mexico. Could you tell us a bit about some of the strategies industry uses that you've experienced directly in your own work, and how have these evolved, in, particularly with digital transformation, which is just opening up a whole new sort of world that's in some ways not subject to the kinds of regulations we're speaking about. Thanks.
Okay. Thank you. The idea that the industry exerts a conflict of interest in public policy making is not anymore a fringe idea. I think it's well understood, well accepted, that whether it's the tobacco industry, alcohol, or the ultra-processed product industry, they all exert that influence. And in fact, a paper that was published in 2021 in The Lancet looked at the levels of implementation of WHO-backed NCD policies and found that only a third of them were implemented. Policies for tobacco control, except for graphic health warnings, junk foods, and alcohol marketing were among the least well implemented. And when they looked at the determinants of implementation, conflict of interest and industry interference were in fact a chief contributor in delays in implementation. So the evidence is there, it's irrefutable. What we also know now is that industry interference doesn't just exert itself explicitly, but also implicitly. And I think this is really crucial to understand and remember. And I'll just present 2 such examples, including out of our work. One is through the ways in which it stitches itself in governance. Public financing of unhealthy commodities is, to our minds, a perfect illustration of this point. We looked at this at Vital Strategies in the case of alcohol in a report that we released last year. We found significant investments in alcohol production in low middle income countries that suffer from the epidemic. And the salt on the injury is that a lot of these instances were development assistance, very little development assistance available, being used in low middle income countries for alcohol production, And then the beneficiaries are transnational corporations. I raise this because this pattern of profiteering by a few transnational corporations is not exclusive to any one of the unhealthy commodities, but is a pattern to be found across all the unhealthy commodities. The other one I'll just quickly describe is in the form of marketing. And marketing, again, implicit, and it's not just about marketing the product, but the habit as one to keep, the industry as a legitimate good actor, in fact, a corporate, socially responsible actor that does the job of government, government to blame, not the industry, and goes so far as, in spaces like digital media, as you said it, hard to even quantify because it's unclear what is marketing, what is not, and cross-border marketing presents unique challenges. So in some, corporate influence has tremendous influence, often implicitly.
Great, thank you. I think you've raised a really interesting point that leads me to Barquera now. So what happens when industry is operating in a bit of a vacuum? In a way, we see in Latin America has one of the highest obesity rates in the world, and ultra-processed beverage and food products are often more accessible than clean water or fresh food and other healthy options. So what happens when there's this absence of healthy water, essentially, and the sugary drinks industry steps in to provide basic beverages, for example? And what are ways that that the social burdens of these unhealthy food environments, what has Mexico done to try to now address that gap so that there's not an opportunity there? Thanks.
Thank you, Johanna. Well, the consequences in Mexico of this changing environment in which ultra-processed food, junk food, is one of the main sources of calories in the diet, it has been tremendous. More than 80% of deaths in Mexico are due to non-communicable chronic diseases. More than 100,000 deaths every year are due to diabetes. And more than 40,000 deaths per year are a consequence of sugary drink consumption. We're one of the countries with higher ultra-processed food consumption. And the efforts in Mexico to modify this food environment have more than 20 years, but it has been very hard. The soda tax took us 14 years of developing evidence and doing attempts at the Congress with the president in the Ministry of Health. The front of pack label system took us about 11 years. So we are happy that we have that now, but we then definitely think we need international collaboration to reduce the times to develop good playbooks of how to do these changes. Other policies that we are attempting, and we need to improve a lot, but we have something is regulations of marketing to children, but we need to improve. The marketing is moving to the digital space. Also, school regulations in Mexico, the schools used to be a space for contact with junk food and with a lot of promotions and sponsorship from food industry. And finally, we discover in all this path the importance of conflicts of interest as a topic that needs to be promoted. I will say ethics. And conflict of interest need to be in the education since very early stages, probably since the childhood, but definitely in the professional area. We think the work of civil society and academia is also crucial to achieve some of the necessary policies, and that has been a very good part in Mexico. The integration of groups that of actors from civil society, academia, government policy makers together. And finally, for the accountability part, international support is very important. I think companies don't like tweets that are international, exposing what these companies, which is like probably 10 or 11 companies, multinational companies, are doing in our countries. So I think this support, these forums are very important to have change. And finally, in these times of COVID and in which the normality is very threatened by these conditions. We saw, for example, reductions in physical activity, increase in ultra-processed food consumption, increase in sedentary time, increase in exposure to marketing to children, and we have new challenges, and we need to identify ways to counterbalance these challenges, and probably some of them have to do with strong regulations of the food industry.
Great, thank you so much. And I also want to acknowledge that we have, this is a hybrid event, and we've got participants on Zoom and on Facebook, and encourage you to start to be thinking about questions you'd like to pose, as we are going to shortly shift from the panel into an audience question and answer session. But first, I want to try to shift the narrative a little bit to something positive, which is that we're actually seeing some, as Simone referenced, some great youth activism. We have young people who are they're key stakeholders, obviously, in advocacy and policy planning. And we have, in addition to a sort of alarming digital environment where marketing is kind of running rampant, we do have popular voices on social media who are helping to advocate. We have young people really using the digital environment in particular, and other environments to call out that what's happening is really fundamentally unacceptable, and to try to drive change. So I'd like to hear from you, Anna, a little bit about how do you think young people are championing and engaging in NCD prevention and nutrition policy processes, advocacy and policy development?
Thank you. Thank you so much, Johanna, and thank you for everybody listening here and online. So that's a great question, actually, because I think that we should acknowledge, first of all, that the world that the youth is envisioning and the youth wants to live in, it's not the world that has been created and decided by, in high-level decision-making spaces. These are two very different and separate sets of values and desires. So it's almost as two different realities. So let that sink in a little bit, because I think it reflects, first of all, this disparity between the aspirations and the wishes of youth with the reality and the actions that are being taken, and that the youth, we're going to have to live in that world that we are not building, or that we did not build, but that's what we inherited. And it also reflects another fact, which is that youth don't usually have access to these spaces, whilst powerful commercial interests do. So lobbying of not just big food companies, big soda companies, but also fossil fuels industries, tobacco industries, alcohol industries, they have had access to these high-level stages of power. Just to put an example, one of the former presidents of Mexico, my country, used to be president of Coca-Cola, the biggest soda company that you can possibly think of, before becoming a president. So how do you even think that any type of policies to prevent childhood obesity or consumption of soda happened within his presidential term? Of course, it did not. And it had its impact, as Simone just mentioned. So, I mean, whilst youth is being outside of those decision-making spaces, industries have been in there. So I think we need to, first of all, acknowledge that. And because youth has not been part of those decision-making spaces, they have created other ones, and they have championed health in other ways. But I want to say that youth is very aware of the industry's impact on our planet, in our health, but also in labor. And I believe that the biggest thing that youth is bringing into the table, and that it's very hard because it's not easy to acknowledge, is intersectionality. You do not just want to talk about issues in a plain manner. We want to talk also about how it impacts on class, race, gender. So we need to have those difficult conversations, and they're going to be uncomfortable, but we need to be ready to embrace uncomfortable, because this is the point where we are standing. And just to give you a more personal example, you know, because of all this industry interference in decision-making spaces, there's rising levels of climate anxiety in younger generations. And it is really taking a toll of us. I have personally considered, for example, not being a mother eventually, just because I have so much anxiety of like, will I live in a city where there's gonna be water availability, which is a decision that my parents didn't have to take. Like, I mean, possibly they were thinking if they were gonna have children for other reasons, but not for fear of not living in a city with water. And yeah, water is going to all these bottling companies. So I don't think this is fair for the younger generations. And we are championing these topics in our own spaces and ready to work with civil society and governments.
Great, thank you so much. I'm just going to ask a couple quick more questions, and then I'm going to ask the audience I'll be switching over to the Q&A session. I did want to ask our minister again. You'd mentioned that you have a prime minister, and I again recognize that you're only very newly in this role, but you have a prime minister who leads from the front. How do you see that being? Do you feel that there are other countries that can be helped by that in a way in the Caribbean, and how do you think that helps drive them? Was the CARICOM strategy, and is there anything about that you think can provide sort of hope and a model for other countries attempting to take on these very difficult issues?
Sure, thank you. Thank you, Ms. Ralston. Certainly, dealing with matters such as SSBs, the sugar sweetened beverages, it is important. And I think a friend, a colleague there had mentioned it. You have to lead from the front. That's the first challenge. I think once you decide you lead from the front, then you have to work with the ministries under your control. Fortunately, in Barbados, the prime minister is also the minister responsible for finance. And therefore, the prime minister understands the cost, what it costs, for example, the minister of health to carry the weight of a budget, but a budget that has to focus on the management of NCDs and generally the costs of healthcare in Barbados. And that cost is not cheap. Well, healthcare cost is not cheap anywhere, but certainly in Barbados, it is not cheap. What it does, however, is it takes an agreed percentage of the annual revenue from the government in the form of budget as related expenditure for the sector. And therefore, if you have a prime minister like we do, who's also the minister of finance, they would immediately recognize the costs associated with the NCDs. I'll give you some statistics, for example. We have a situation where we have a prevalence of diabetes of approximately 18% of the country. In addition to that, we also have obesity and the prevalence a rate of those persons who are 25 years and older at 33.8%. When you look at the healthcare costs, not only primary care costs, but also the cost of carrying our lone Queen Elizabeth Hospital, that is substantial. That can cost us upwards of 230, 240 million. Nothing to do with capital expenditure that is required for ongoing requirements. So I think the Prime Minister, based on her leadership and the way she's able to connect a message with people, understands as well. I know she's championed this through CARICOM, and she will continue to champion through CARICOM. But we are planning to take an additional step. And what we intend to do is to have a meeting with the stakeholders, importers, wholesalers in Barbados. And once we have that meeting with them, we will start to discuss how best to go about with further reduction of sugar and salt, sugar and salt content. And once we get that, and that's the leadership that's required. So the Prime Minister says, look, this is your mandate, Ministry of Health. I want you to go there and I want you to meet with the stakeholders and report to us. And then we'll have the policy prescription. But in accordance with our tripartite system, where we always involve the private sector, the union, and of course, government, we are going to have that discussion. But I think that other leaders within the region could follow our Prime Minister's lead in respect to how you implement it. And I take note that Barbados was the first country in CARICOM to take the lead. And that tells you a lot about the leadership of Barbados.
Absolutely, absolutely. Thank you. Thank you so much. Okay, so we're now going to go to questions from the audience. And so we have, Do we have microphones? Sorry. Okay, yes, so we have, so if you would like to ask a question, please raise your hand and somebody will come to you with a microphone, and please do hold it close to your mouth. I'm also going to ask our colleagues, so we have a question up front here. Okay. Is that right? Yes, okay. And we will also be taking questions from online. Again, we do have an audience on Zoom and on Facebook listening in and participating. So please, if you could stand up and identify yourself. Thanks.
Hi, I'm Brendan from Australia with Global Voices. I'm grateful for the comments and things shared from the panel. Just for context for my question, I do a lot of clinical work, not so much in the academia space, but I appreciate the environment focus of the marketing side of policy. Keeping in mind that clients and people can lose weight or body fat, which I guess we, in simple terms for obesity, they can do that still having a processed diet. And so my question is it more important to maybe teach children or people how to get themselves into something like a caloric deficit to lose weight, which naturally improves cholesterol, sugar levels in the blood, all kinds of physiological benefits, versus just focusing on the environment only? Or is there anything going on to focus from within to help these people have the tools and the power to actually change their bodies regardless of what foods they eat, just so we can at least start helping them lose weight rather than trying to fight addiction and willpower? Is that not clear enough maybe? So my question is more so focusing on, is there anything going on from within the people to help them have the tools to do change for themselves rather than just solely the environment and marketing alone?
So, and a bit about an individualized versus a sort of a societal and environmental approach, which should be a priority.
If we could teach people to get into a deficit regardless of diet, they would naturally drop out of that obesity category and improve health straight away. So,
okay, great, thanks. Would Francesco, did you want to try to respond to that?
Sure, no, health literacy is important, but there's 3 billion people in the world who cannot afford a healthy diet. And, the pressure to consume processed food is so high. So we need to change the diet. We really need to have a food system-wide approach to supply, food environment, and consumer choices. So that's why, we need to have those different elements, but unless the food environment is conducive to those choices, we're never going to be able to. It has to start from very early in life. It has to start with complementary feeding. We have a lot of, if you go into the supermarket here, try to find a yogurt without sugar, it's impossible. So the food environment for children is so critical to make that happen. And then, once people are accustomed to certain diets, maybe it's becoming easier. I agree with you. It's not only an energy point. It's also, comprehensive offer of diets which are high in whole meal cereals, legumes, fruit and vegetables. It's not only the excess that's a problem. It's also the insufficient consumption of the healthy components of the diet.
Great, thank you. Did you want to say something, Simon?
Just one, I agree with what Francesco said. In Mexico, for example, obesity and non-communicable chronic disease as the main cause of disease has not that much time. It's like maybe 40 years that it started increasing, and 20 years in it is the main problem. So it seems that before that, the conditions of the environment didn't cause this problem. And the education was not that focus on healthy diets, but the environment was healthier. And just one example, 2 administrations ago, there was a very important campaign to drink water in schools. So we developed the healthy hydration recommendations. But when the kids went to the recess, in the school canteens, all what they sold was sugary drinks. So definitely didn't change the behavior because the environment was still very obesogenic. So I think it's very important to do like changes in the food system and the environment, and then obviously work intensively to have a good health literacy and nutrition and consumption literacy.
Thanks. Now, we've heard a lot about at this session about sort of national challenges and from Princess Dina really focused on the sheer magnitude of how much unhealthy diets, unhealthy access to unhealthy food and beverages driving disability and death around the world. And now we are in a time that is so complex that we also have many populations on the move and many people in humanitarian settings, particularly now in light of the fact that what's going on in Ukraine, but also in many other parts of the world. So we're wondering, are there any, we have a question from online, and I would really also encourage people online to, if they wanted to offer responses as well, but any comments on sort of successful policies and programs around addressing NCDs and NCDs associated with unhealthy foods in humanitarian settings? What are some examples of success? What are some examples of challenges around promoting healthy diets in humanitarian settings, which are obviously an unfortunate reality of current times? Were there any, did anyone have a comment on that? Example on that? Francesco, do you have any knowledge of that?
I won't take the floor all the time, but yeah, definitely this is a big issue.
Yeah.
I mean, we have a lot of emergencies which are chronic emergencies, and the kind of rations, for example, that have been distributed in acute emergencies, which are basically the flour, the cereals, the sugar, and the oil, are not suitable for those chronic emergencies. You need to have fresh food. I myself have been working in, the Western Sahara. People have been there for 25 years. Of course, you had obesity, and the ones dispensing humanitarian aid wouldn't believe that obesity was there. Of course, it was there. So, do we have good practices? We're changing the practices, even in social protection systems now. It's not any longer like, we're proud to offer you a muffin and a soda as a school meal, but it's more into fruit and vegetables. But there's still a long way to go, because, often the logistics is complex, and, fresh food needs to be provided in the right amount. But I think there's certainly greater awareness in the humanitarian community about non-communicable diseases and about, the need to provide healthy diets.
Nandita, did you have any examples in your work of working in humanitarian settings as well?
It's a great question. And in fact, whether it's the food industry or even the tobacco industry, there are examples of corporate capture of these opportunities to market unhealthy products. And there were examples of this during the COVID pandemic, where unhealthy foods were provided as part of the food basket. And a number of our partners in Colombia and other countries have actually documented this. So this is yet another instance of corporations stepping in and claiming the job of governments and then presenting themselves as good actors, when in fact, what they're dispersing is unhealthy products.
Absolutely. Well, speaking of COVID, Minister, I wanted to ask you too, how had COVID impacted sort of the food environment and access in Barbados, and particularly among young people, let's say?
Thank you. Certainly, we, as I indicated, we are net importer of food into Barbados, and therefore supply chains would have had its challenges. Mercifully, we weren't impacted seriously. We were still able to provide our population with required foods. One of the scenarios that perhaps we've been faced with is that obviously persons were at home with their families, and therefore perhaps they had an opportunity to consume more of stuff that we perhaps would not have wanted them to consume. And that would have led to its challenges. But fortunately for us in Barbados, there's still that sense of consciousness that would have allowed persons, as time permitted, to exercise. So there was an opportunity to exercise during the pandemic, which would have helped persons. We obviously would have, during that period, sensitized persons through regular what we call public service announcements, in respect of a number of challenges that they may have obtained. But the primary focus on during COVID was on the COVID challenge itself.
Right.
And that took away a lot of the resources that we would have otherwise have had in our arsenal to deal with. And therefore, there are some programs, yes, that were compromised, like, for example, health promotion, which is a critical component of the ministry, that would have been compromised. But I just want to piggyback on a point mentioned earlier, and it has to do with the nutritional value of of food. And Barbados, actually, almost 2/3 years ago, the cabinet of Barbados would have agreed to a Barbados schools nutritional policy. And that will complement what we're doing on the side of the NCD program. So effectively what we're doing is that we're encouraging children to drink more water, for example, less carbonated beverages. We can have water with a fizzy feel, which obviously will sensitize the taste buds. But we are moving in that direction, and we're going to have an integrated approach, not only with the Ministry of Health and Wellness that I have the honor to lead, and I also have with us, for your information, our Chief Medical Officer who's here with us, as well as our Permanent Secretary and others. And we are championing that school nutrition policy through all schools in Barbados. It will also address issues, for example, of what is sold on the school compound and what is sold outside of the school compound. And we believe that along with the SSB taxation and the strategic intervention of our Barbados schools nutrition policy, that we will be able to start the process. Now, we aren't going to get there tomorrow. It will take us some time, but we've also factored in key measurements so we can monitor the success of the program over time. And we believe that if we're invited again, we could come back and share some of that, some of those results with you. But just to let you know that Barbados is on the path of Barbados National School implementing the school's nutrition policy, along with the other necessary measures that are needed at this critical period to reduce NCD prevalence. Thank you.
And other questions? So could we see, let's see, yes. Thanks.
Hi, good afternoon, everyone. I have two questions. One is for Minister Gooding-Edghill and one for Dr. Simon. The first, I want to introduce myself. My name is Stephanie Whiteman. I am a NCD child young leader as well as a public health researcher. I'm from Trinidad and Tobago, and I've had the great pleasure of making Barbados my home for the past 5 years while I'm completing my schooling. And the first question I have for you, Mr. Gooding-Edghill, is, does the Barbados government have any plans or initiatives in place to improve the health literacy of the population, given that there are so many policies now coming out, the sugar sweetened beverage tax, the 20%, now the school nutrition policy that's coming out, to ensure that the population understands the reasons behind why these policies are being implemented. Because from my observations thus far, that's where the mark is being missed a little bit, where the general layperson, they know the policy being implemented, but the reason behind the why is not necessarily translated that well. So I just want to know if there's any plans for that. And then I'll just say my second question from Dr. Simon. In your opinion, what are the gaps or where research should be going now to improve the creation of healthy food and for the creation of a healthy food environment? We've done there's research done on the creation of front of package labeling. There's research that's done to show that the sweetened beverage taxes are effective. There's research on the improvement of creating food wastes, but taking away food deserts and taking away food swamps. What's the next step in the research right now? Where do you think needs to be evaluated? Thank you.
Let me say thank you for spending the 5 years in Barbados. Hope to see you back there soon. Yes. No, this is a matter when we were discussing the Barbados Schools Nutrition Policy that we had a lot of discussion on. It had to do with public education. It is good for a government to implement a policy and say, okay, we are going to adjust the SSB tax and we're going to take it up to 20%. But what happens thereafter? There are some people, if they have the disposable income, they will continue to purchase. So what we are executing is a planned public education program. We have to explain to, in this case, Barbadians, their health risks and associated risks. We have to go into greater details about the level of NCD prevalence in the society and what that means, for example. Do you want to continue on a path that eventually will see maybe a separate limb, or would you prefer to choose a path that will see you living a normal life like any other person? And then we're going to dovetail that into discussion with the disabled and how best we can prevent that. But what is required is a general and a sustained public education program, and that is part of the plan as it relates to the NCD. Now, once we've completed the discussions with the stakeholders, we're going to ramp up that communication program. And it's not going to be just today and not tomorrow. It's going to be on a sustained basis because it's absolutely necessary. We are also going to twin, as I indicated, the Barbados School Nutrition Policy must have a significant and sustained public education campaign for our students in Barbados. We have in Barbados, we provide what we refer to as school meals for children at the primary stage. At the secondary stage, we don't, because they bring their lunch to school. But we are going to effect nutritional change and value at the point of the infants and take it all the way through to that stage. And then we will layer in with another public education program to deal with those persons at secondary school and then moving on to the tertiary level. And that is the way we believe that we have to do it. A simple tax will not get it through. A minister or ministers in parliament talking about the significant impact of it will not take it through. What is required is a sustained public campaign. We are fortunate in Barbados in our Ministry of Health that we have health promotion officer, and we are going to strengthen the health promotion office to allow them also to get out there and spread the message. And as part of the school nutrition program, we have a department within the ministry known as the National Nutrition Center that is in the Ministry of Health and Wellness. And we are going to, as part of the policy, allow those officers to go out there and talk to the Parents Teachers Association, talk to the students, and talk to other interest groups about healthy diet. We have, even within the Ministry of Health, and we're responsible for what we refer to as geriatric hospitals or senior living facilities. And the dietitians there have done a great job working with nutrition officers in augmenting the diets. And that is what we have to do. So I can sit here and tell you, as the minister responsible, along with the CM1, PS and others here, that we have a coordinated and a sustained plan. But more importantly, as I indicated earlier, there has to be a measurement. We have to measure and see if we're making an impact. For example, the fact I told you when we had the 10% taxation rate, we saw a 4.3 decline. But it wasn't sustained. But truth be told, we weren't the government at the time. But now we're the government and we've implemented it. We've also set ourselves key benchmarks to measure. And within our Barbados Schools Nutrition Policy, those expectations and outcomes have been clearly defined, and we are going to monitor them on a semi-annual basis, and we are going to take that measurement through. And like I said, so anything we have an opportunity to come back, I'll be able to tell you, well, did we succeed or did we fall short of our expectation outcomes? So that is what we are trying to do in Barbados. Like I said, it will take some time. It's not going to, you're talking about changing taste buds. And we know, for example, if you have a child, like a baby, for example, and you didn't expose the baby to any soft drinks, for example, or sugar sweetened beverages, that child will probably grow to just accept maybe something else. But as long as we introduce SSBs to the taste bud, then that child will become. So we have to start at that very young, tender age and work it through the system in order to allow it. That's why I said it will take some time to go through. Sorry for taking the explanation.
No, it's great. And actually several other panelists want to respond to this as well. I'm going to start. Nandita, you wanted to say something.
Just really quickly, I wanted to reinforce that point about the importance of public education and health communication campaigns along with policies. We've seen this in the case of Mexico. We've published on this in South Africa. We're about to publish a paper on that experience in Jamaica, where we found that the use of health communication coinciding with the introduction of policies is crucial to building support and enabling policy passage. And in fact, there's data out of the US that's shown that the lack of that kind of public engagement has often caused policies to not sustain and to not pass. I wanted to reaffirm that. And second, I also wanted to just shout out to the Caribbean region and the strong civil society partnerships there that are also crucial to this kind of policy passage. In fact, a campaign that I know has just launched by the Healthy Caribbean Coalition called Make It Make Sense, that not only encourages these policies, but also calls out industry interference. So
Great.
just wanted to reinforce and thank you for that.
Did you want to, Princess Dina wanted to make a quick comment as well. If you wait for the microphone so that the online audience can hear you.
Thank you. First of all, well done. It's amazing that you've taken up this. But what about also adding, you have those campaigns that will be intermittent, even sustained. What about putting in textbooks? We all know children, from kindergarten, maximum, well before teenage years, they really absorb everything the teacher says. So far, we know that. And if you put it in textbooks in a very indirect way, not in a lecturing kind of way. In mathematics, they can do a topic where they, for example, percentage of salt, this, something we implicitly discuss, contents in a food. And perhaps the teacher can say, they can see the difference between high fat, low fat, in a percentage lesson in math. In art, they can do something. In biology, they can, you can have some information with that. Even in English teaching, you put a paragraph about what's in a food and so on. They think they are reading some, something to do with English, but in an indirect way, you are putting this topic. And teachers can do it in a very age-appropriate way. And you can have really a topic in every single subject from grade 1 until minimum of you can even go, of course, up to high school and so on. We're trying to do that. I'm trying to push this idea for anti-tobacco in Jordan because kids are so fed up. Fed up of lecturing, but maybe we can capture the new generation in that way. At least they know the science and the facts and without the lecturing part. So just an idea.
Before we go to Simone, I'm actually going to ask Anna, how do you think that relates to, how do you think children, we've heard a lot of examples of how it's using schools as places of influence. You are actually doing really interesting research on digital, the digital frontier and the wild digital world, and how influencers are used both for negative as well as potentially positive. How do you think this would counter or sit in relation to what children are exposed to on the digital landscape?
I completely agree. Children are greatly exposed to the advertising of several unhealthy commodities in digital spaces, not only foods and beverages, but also tobacco products and even alcohol products. We know that, and I think that would be a great idea, but also, I don't know if you've been spending some time on TikTok lately, but I have learned so much about people so much younger than me. There's so much creativity going on in social media, and also, listening to how younger generations, younger than me. Yeah, I'm not an expert on TikTok or anything, but there's so much creativity on how to communicate issues that might seem so complex. And I think this in a way shows that, yeah, children and youth are so much more aware than I think it is acknowledged. I think, yeah,
great.
We just need to contact.
That's great to hear. Thank you. Simone, there was the second part of the question.
Yes, thank you for that question. I think there are some opportunities that are very clear and that can give us results ready for implementation very quickly. For example, we have now regulations on the front of pack, but not that much regulations of the retail sites in which the consumers are buying the food. So for example, in Mexico, many of the marketing that is not anymore in the package, like the mascots, the cartoon characters, are now in the retail sites. So we need to, we are exploring that, and we are developing a toolkit with UNICEF that will be ready to assess the retail sites in many countries and to identify opportunities for more regulation that protects children. So that's something very straightforward that I think is a trend. Another trend is digital marketing. Digital marketing is becoming very generalized. As more regulations in the not regular marketing are in place, companies are moving to the digital area. And we are also exploring that with UNICEF and with Bloomberg. And I think that's very important. As Princess Mired mentioned, the education at schools and the development of books for children, but not just like with the ideas or the knowledge, but the research that demonstrate that they are able to modify their behavior with this information. So this trying to be appealing and fun, and also to communicate properly, that needs a lot of research, and there are some efforts that are going in that direction. And finally, I think we have many decades trying to improve breastfeeding practices and to implement the codex, the codex for breastfeeding in different countries, but there is no progress. And I think in many narratives is not included in the obesity. For example, in this World Assembly, the non-communicable disease topic is one, and nutrition in breastfeeding is another. And I think this is something central to non-communicable chronic diseases, like early start with proper nutrition. So we need to be very firm trying to promote the necessary regulations to implement the codex of marketing of breastfeeding substitutes.
Great, and thank you for raising the importance of not just breastfeeding, but prenatal and maternal health to address it, to helping to protect against obesity through the life course. Next question here, third sentence, and I'll...
Okay, thank you very much for the panel. I'm Andres Quintero. I'm a part of the delegation of the International Federation of Medical Students. And my question is for all the panelists. So as Anna mentioned, it has been very complex, all this issue of health and how we as future generations are going to be facing this problem. So in your own context, how would you consider to include you as part of these uncomfortable decisions that we have to be doing in the future years? And to Anna as well, that if you can give us a message about what you would like to hear from the different stakeholders, from researchers, from policymakers, from NGOs, and for example, WHO officials, to include you or not, or how to include you in these very difficult conversations. Thanks.
So essentially, for all the panelists, how to include ways to include and engage youth, broadly speaking. Okay. Did anyone want to volunteer to start on that? Okay, Anna, the youth will start. So.
Yeah, so I think it would be amazing if every country delegation could have a youth presence as part of the delegation, integrated with the other members of the team. So that would be part of the progress. And, accounting for what I was mentioning about who has had access to these decision-making spaces in the past, I think it would be a great commitment for countries to take into consideration binding efforts to prevent from health-harming industries to become part of the decision-making spaces. So I think, for example, the Convention for Tobacco Control, the Framework Convention, is a great way to start, and I think it can be used kind of for other health-harming industries as well as a framework. So I mean, I think that's a very useful tool, and I know WHO has been going forward on these conversations as to how to prevent conflicts of interest in decision-making spaces regarding health and nutrition. So I think that would be a great start for different countries.
Great, thanks. Simone, did you want to speak to? Oh, okay. Did Nandita, or did you want to say anything about youth involvement in your work, or?
Well, my daughter's going to be very happy to hear me say this. She asked, I have a 7-year-old, and she asked me what I do for work. I explained it, and she said, Mama, why don't you just increase the prices on things? And I was stumped. She's 7 years old. Very savvy. And I told her, I will let everyone know that she said this to me. So I'm going to record this and show it to her that I did indeed. I was blown because I think sometimes the answers are very simple. We're just clouded over, our judgments are clouded over by a lot of complex things. So I think the youth say it, so I'll leave it there.
Great. Did you want to say I think you've already, I think you've gotten great comments. So hopefully that's helpful. We've gotten some great ideas from you. Yes, here, in the second.
Thank you so much. Thank you for the floor. I am a student from Lithuania and I'm representing International Pharmaceutical Students Federation, but I would have a personal question and concern. Maybe you have any ideas on the specific topic of, well, as it was mentioned during the panel discussion, the financial interests of the industry of junk food. Most of junk food producers, they are kind of advocating for it's customers' choice. Customers know the best what they want, like pushing for liberal ideas that whatever they feel like they should have access to and right to eat it, and what kind of food authoritarianism would it be to limit foods or to tax foods or to somehow reduce access to those foods. Although we all know that the practices are not very ethical. For example, putting people into fMRI scanners to detect the so-called bliss point, which is a perfect ratio of sugar and salt that surpasses the mechanisms of being satiated. So basically making people to eat indefinitely of some foods. Or for example, that Coca-Cola has said, if only all people who drank Coca-Cola would exercise, calorie is a calorie, we wouldn't have obesity epidemic, although we know for sure that 300 calories from marshmallows has very different impact on the physique and metabolism of human than 300 calories from like salmon. So how do we not infringe on customers' rights to choose the products they want, but at the same time guide them towards better choices? And the fact is that most of consumers know what is best for them, but still they choose something, you know, short-term gratification over long-term good health and sustainability. So how do we strike a balance between those? Thank you so much.
Simone, did you want to try to answer that question?
Yes, it's a great question, and we think a lot on these comments that you made. We discuss that all the time. So only a few ideas. One, I think when they tell us, why are you wanting to tell people what to do? We say, well, people can do whatever they want, but they need fair information. They need complete information. So we are not forbidding the consumption of junk food, but we want fair information and packages, for example. And also we don't want a marketing directed to children that is designed to cheat them into consume things that probably they do not want, but they create the necessity. So these are important points. Another problem is in the part of education to teach the people to see ultra-processed food, junk food, not as food, but as products of consumption, unhealthy products of consumption, and try to differentiate that from real food. And that's something that we need to do. And we can do. And the last point that I think is also a border in research, the counter-marketing strategies and education in of children in counter-marketing. So be able to understand since very early stages that marketing is trying to cheat you, and how to respond and be critical about marketing. And I think we are discussing in Mexico right now how to implement a program to teach children to respond smart to this marketing. Don't let it cheat you.
Johanna, may I just add quickly
Please
to that?
Please do. Yeah.
I think we need to look at the behavioral sciences on it. There's a huge marketing literature on choices and choices in decision making. And the fact is, most of us use shortcuts in decision making. We're making decisions using what are called peripheral cues. In the case of food, we know that the decisions and choices to buy a food product occurs in a few seconds. So we need quick visual cues that will alert people to something that's unhealthy. Hence the case for warning labels. In fact, authors at Vital Strategies, we've argued for ultra processed product labels as well.
I think unfortunately we're out of time, but we have a reception starting immediately after this. And so you can feel free to approach the panelists with any questions that you might have. Thank you I want to just, first of all, a round of applause for our panelists. That was really I feel like we have the all-stars of the world here in terms of different ways of addressing nutrition-related NCDs. I'm just going to make a couple of, sort of to summarize, I think, what we heard. We heard a lot about leadership. We heard about political setting an example, and in a way, political courage that's needed to implement some of these, because there's a lot of forces that resist it. We heard about both the good and the bad of the digital world. I think that we heard some very encouraging models of creativity to counter some of the negativity that we see in the digital space. We've heard a lot about we've become more savvy regarding tactics, regarding how we're being used in a way and marketed to, and so really the evidence is there. And in a way, as a measure against that, the idea that voluntary approaches will be enough, I think we can move beyond and say we really do need stronger regulatory frameworks. We've obviously heard a lot about youth, and what we need to make sure we don't do is what often happens in health conferences around primary care, is say it's all going to be up to the youth to figure it all out like this. So we need to support youth tremendously in this world that they've frankly inherited that's got a lot of challenges. But we've also heard some great examples of how we can influence education, influence curriculum, which is a great idea, and also creatively use the digital environment as another measure. And then we've heard a lot about implementation, some of the challenges, but some of the really exciting research and models of success that are going on in implementing strategies. So within all of that, there was I think an overarching message of the challenges, but I think that there's a lot of hope and things in terms of how we can take success stories and try to amplify them, and particularly support one another when there is significant industry interference, along with just the challenges of so many other difficult situations competing for attention and resources. So it's important that we again call on member states and each of us to advocate for, and to the extent that we represent member states, to drive our own states to accelerate implementation of WHO best buys, particularly those that are most difficult to implement, which is the food-related best buys, to reduce unhealthy diets and halt the rise of obesity and diet-related NCDs. We need to encourage WHO itself and civil society to hold governments accountable for their commitments, particularly those made in 2021 at the Food System Summit and at some of the other nutrition-related events that helped set the agenda for the next 5 and 10 years. Member states, civil society, and WHO need to establish mechanisms that expose and stop industry from interfering, from telling us lies, as we've said, undermining implementation of solutions, and having that disguised in various ways as philanthropy or creativity or arguments for freedom. Welcoming participation. So and then we also just want to again acknowledge that a lot of the issues we're talking about sit between food and nutrition and health, and sort of between these two worlds. And so we need to make sure that food-related, diet-related NCDs are given prioritization when they can sometimes get lost in the mix between, is it a food issue or a health issue? So without further ado, I just want to say thank you very much. It's been an honor to be here tonight. I've really enjoyed this panel. I've enjoyed hearing from all of you. I've enjoyed hearing from our friends online who have been very engaged, and thank you very much for your participation as well. And now it's time to have some food, or to have at least some beverages and potentially a bit of food too. Okay, so let's enjoy that. Thank you.